Hello.
Hi, everyone. Hello, I'm Susan Cole.
And I'm Matthew Hodson.
And we are so excited that you're here to join us for aidsmapCHAT, a live show bringing news about HIV for people all around the world.
We have an exceptional lineup of award-winning guests this week. We've got Professor Kevin Fenton. He's the lead for public health in London, and he's also heading up England's HIV action plan. We also have an award-winning changemaker from Zimbabwe, Martha Tholanah, and sex worker and queer wellbeing activist Kayden Gray.
What an incredible lineup we have today.
I know, aren't they just fabulous? And they're all just completely gorgeous. We've just been in that digital backstage space with them, and they are so much fun, and I know we're going to have a great show. But before we get on to that, I just want to say to everyone, Happy Lesbian Visibility Day today. It's, I think one of the things, I did an interview the other day, and it was about HIV, and someone said, blah, 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 we're talking about communities which have a very high burden of HIV. And I instinctively said LGBTQ, and then realized, well, of course, actually, lesbians do not have a high burden of HIV because prevalence is low and HIV isn't transmitted in sex between women. But then I was thinking about all of these wonderful women who've been so involved in the HIV movement over the years. Just in the UK, we have Professor Chloe Orkin, who's one of the smartest, best researchers, best clinicians that we have. We have Deborah Gold, who heads up National AIDS Trust and a very close friend of mine. We have the wonderful Lisa Power, who was there right at the beginning of NAM aidsmap when the National AIDS Manual was being put together at Lesbian and Gay Switchboard, and who then has been a mainstay of Terence Higgins Trust and Cardiff Fast Track Cities. So really, I'm just so proud and honoured to have so many wonderful lesbian women who have been a part of this great movement.
They are all absolutely wonderful women, and Lisa, Chloe and Deborah were all at the British HIV Association conference last week.
As were you. Tell me about it.
Indeed, yes, it was incredible to be at the British HIV Association in-person conference for the first time in 2 years. It was wonderful to see so many people in the flesh, and there were loads of really exciting news stories and presentations, including things about injectable PrEP and who's going to get it. But what really stood out for me were presentations and studies about some of the inequalities that we're seeing, including people who are lost to follow-up in HIV care. There was a really interesting presentation by Dr. Kate Childs, who looked at loss to follow-up in South London, and it was extraordinary that what she found was that actually people from racially minoritized groups were more likely to be lost to follow-up, and very often it was Black women who were facing intersecting forms of stigma and discrimination and challenges. And Kate luckily had funding from Elton John AIDS Foundation to get people back in care, which was fantastic. But what she highlighted was that it's so important that other clinics do have this funding, and also when people do re-engage with care, that they're met with, they're welcome and there's no judgment. And also that we do everything that we can to recognize that people who are experiencing mental health challenges are more likely to be lost to follow-up. So lots of important work that needs to carry on. But shall we bring on our next guest, who is perhaps one of the biggest experts in the world about public health issues?
Yes, it's Professor Kevin Fenton, who is the Regional Director for London of Public Health.
Hi, Matthew. Hi, Susan. So great to be back with you again on aidsmapCHAT. And Susan, great to hear about the British HIV Association conference as well, which I thought was excellent. So great to see you both.
Wonderful. Thank you so much for coming on and coming back. So Kevin, what measures are you hoping to introduce to diagnose the undiagnosed with HIV?
Well, Susan, as you mentioned, this is a real challenge for us. And although we're making excellent progress in the United Kingdom and in England in diagnosing people, linking them to care, getting them on treatment, and being virally suppressed, we know, as you've just mentioned in this study from Kate, that there are people who we're not engaging. And it means that we need to ensure that at the point of diagnosis, we are having thorough conversations with people who are diagnosed about their needs, mental health, social, economic support needs, and that we have the mechanisms in place to support people as they progress with their treatment journey. So, a much more proactive way of both understanding, measuring, and supporting patients, I think, will be needed.
And I mean, the topics we've been talking about, making sure that people are diagnosed, making sure that people are retained in care. I mean, obviously, these are vital to our goals to end new HIV acquisitions in the UK. Now, you're in charge. You have been charged with the mission to end new infections in the UK, in England by 2030. Are we on track? Are we going to get there?
So, Matthew, it's such a privilege to be having that opportunity to lead the HIV action plan implementation. And yes, as I said, we're making good progress. But remember, as we approach the elimination of transmission of any infectious disease, including HIV, the work gets harder because the infection itself, for example, HIV, becomes more concentrated, perhaps in some of the hardest to reach or hardest to engage communities, people who may not be accessing care regularly, or, as you mentioned, Susan, people who may be dealing with many other social, economic, health, or mental health issues. And that pattern is what we're seeing in HIV. So, Matthew, it means that our work becomes harder as we approach elimination. But the HIV Action Plan brings so many people together to really focus on this end stage of HIV. And so I'm optimistic about the journey.
I mean, of course, when you've kind of been given a long plan ahead, and life interrupts, and then we've seen that obviously very profoundly in the last couple of years with COVID. And there was a report which was presented at the British HIV Association conference, which said that whereas we had previously felt that we were doing so well with 91% of all people who are living with HIV in the UK actually being virally suppressed, but perhaps partly as a result of disruptions caused by COVID, that figure may not be as great. That may be an optimistic representation of where we're at. I mean,
that's right. Those were data from, I believe, the UK Health Security Agency. And Matthew, this really fits in with a wider pattern that we've seen in terms of the impact of COVID, right? So as we are emerging from 2 years of the pandemic, we know that mental health issues have worsened. Obesity, heart disease, a range of other health conditions have got worse because people have not been able to engage services or to be connected as they were pre-pandemic. And HIV seems to be no exception either. So we are now seeing data where perhaps people where we may have been better engaged before the pandemic, an impact of the pandemic is affecting how people are engaged. And that's why our catch-up or recovery post-pandemic has to be about re-engaging people into care. As Susan, you said, looking for incentives on how we support systems to reach out to patients, and of course using data as well, so that we're confident that we're engaging the patients and we're tracking patients moving ahead. So this impact of COVID, I think, is going to be really key.
Yeah, absolutely. And COVID really shone a light on existing health inequalities. Last week, the All-Party Parliamentary Group in the UK released a report on how HIV was affecting people from racially minoritized communities, and the health inequalities are quite shocking. What do you think we need to do now to address that?
Well, Susan, first of all, let me just say I welcome this report from the All-Party Parliamentary Group on HIV because it does shine that light on inequalities. And again, coming out of the pandemic, I think we're in a moment in time now where whether you're working locally or nationally, we are now more focused on tackling inequalities because we've seen these widened, not just for HIV, as I mentioned, many other conditions. And the APPG's report, the report on inequalities, really is setting out things that we must do now to catch up and to reduce those inequalities. And some great recommendations from targeted HIV testing, targeted campaigns, really engaging with local communities, tackling stigma are some of the things that I certainly will be working on our HIV Action Plan partners to ensure we implement. So really good to have this focus from that report.
Wonderful.
Thank you, Kevin. Thank you so much for coming back on the show, and thank you for everything you do. I feel really secure with the HIV Action Plan in your hands. But I wish you luck with it because it's still a big challenge.
It is. All right, guys. Thank you so much, and thank you for all you're doing.
Kevin. Thank
Good.
you.
Take care.
And that the report from the All-Party Parliamentary Group on HIV and AIDS, Nothing About Us Without Us, looking at the HIV needs of racially minoritized communities, is available online. I'll probably tweet a link to it later.
Yes, absolutely. And it's wonderful to be one of the contributors to that report. So I'm very excited about it.
I mean, I'm just lucky to share a studio with you. Not that we're in a studio, but you know what I mean.
A virtual studio.
Award winner Susan Cole.
Well,
what else grabbed your attention at Beaver?
Award-winning Matthew Hodson. Something else that I really love to see at the British HIV Association conference this year was so much research presented in the form of posters by women living with HIV who were leading this research, and much of it was commended and praised, and there were fantastic things out there such as Bakita Quesada talking about formula feeding choices for women living with HIV, the 4M Network report on pregnancy and HIV. But what was really especially exciting was to see a project that NAM is working on in partnership with the Sophia Forum, Positively UK, UCL Global Health, highlighted at the conference about issues affecting women with HIV as we get older. So watch this space. There's lots of exciting information coming out of that, and lots of videos produced by NAM about issues affecting women as we get older to help on our journeys, and lots of menopausal vagina information. One of your favorites, I know.
Absolutely. I am there for it.
Excellent.
I don't want to do the segue to our next guest from that. But our next guest is a wonderful activist, change maker from Zimbabwe. Her name is Martha Tholanah. Hi, Martha.
Hi, Matthew. Hi, Susan.
Hi,
nice
Martha.
To be here.
Wonderful to have multi-award winning Martha on our show today. Martha, what would you say needs to happen now to ensure meaningful involvement of women living with HIV in research?
Thank you, Susan. I think there's much that can be done that is very simple. There are a lot of women who are interested in women with HIV who are interested in research, and particularly when I look at the situation in Zimbabwe, the women really need to be involved in research, but they are not. It seems to be a big wall for women to be able to be meaningfully involved. I think there needs to be a deliberate reaching out to women by the research institutions in Zimbabwe to actually make sure that women are trained research literacy is important. Once women know the basics, and also that they are guided in how to do it, because they have lots of information that they have. The only thing is that we do not present it in the way academics do, but in many ways we need that guidance. But we do have, there's a lot of rich resource sitting with women and girls living with HIV. So yeah, women just need to have that encouragement. They need to find that the research institutions and academics are open to working with them, and the women will be there. And yeah, thank you.
I want to ask you about, because Susan is obviously going to talk about women, and I'm obviously going to talk about the queer stuff, because that's what I'm here for. But I mean, I think it's, I know that you won awards, but you're very vocal, for the rights of LGBTQ plus communities in Zimbabwe, and the situation in Zimbabwe for LGBTQ plus people is not great at the moment. It's definitely it's not following the lead of South Africa, where actually LGBTQ rights are pretty good. I suspect I'm probably wrong on the history of this, but I mean I do know that it's colonial era laws in many nations, and but what's the actual impact for people on the ground at the moment of the legislation and the social attitudes which are against LGBTQ people in Zimbabwe?
Yeah, it has been very bad for LGBTQ people. Sometimes you see changes which goes in cycles. Like sometimes you find that there's a bit more relaxation, and then sometimes you see that there's a bit more, what would I call it, repression, would I say, but also I mean rejection, both by official institutions and also from the communities. But in terms of the communities, I think there's slightly more progress there, because people are beginning to understand that we do have the LGBT community amongst us in Zimbabwe, who are Zimbabweans. We have never had any influence from anyone coming from the West, and a lot of times it's also finding that these are part of families. These are part of families, and no one wants to reject their family member. So in many ways, people are actually reaching out to actually find how best to support a relative. I think in my case, when I started as working as a staff member with the LGBT community, that was probably 19 years ago, when I first got a job with Girls. And at the time, Girls was the only organization in Zimbabwe that was an association by LGBTQ and for LGBTQ. And for me, coming in there, it was so much to learn, I think, on both sides. On my side as well, I was learning much more. I used to hear about it, and I thought it was just as simple like walking into any other job. But I had so much to learn from the community, from the LGBTQ community. But I think they also had a lot to learn. But also the biggest thing that I got to learn was how homophobic the society was, which I hadn't realized the extent of the homophobia. And I wouldn't have realized that if I hadn't gone to work with Girls. But also, I think in many ways, even though I worked for 4 years, that many years ago, I've remained a part of the community, being an ally, supporting them. And also I see the support as reciprocal, because they are more than LGBTQ. And I think this is what we've tried to do. Right now, there are about 17 organizations now of LGBTQ in Zimbabwe, which means there's a bit more relaxation and a bit more confidence in the LGBTQ people, deciding to reach out. And also we see that there are more allies. I'm telling you that when I worked at Girls, a lot of times I was ridiculed in meetings, but I kept going back to the meetings, to workshops. So it was really, it was very easy to just say, no, I'm not doing this anymore. Let me just walk out. But I'm happy that with the support of my family of origin also were supporting me, even though a lot of them didn't understand why I was so crazy to do what I was doing, but they still supported me. And also the support from the LGBT community themselves. So I think in a way, there's a lot that needs to be done because the work is so much. There's still cycles of homophobia and pockets of homophobia that you find in a lot of places. Yeah.
Yeah. Well, thank you so much for coming on and sharing all of your important insights, Martha. It's been wonderful.
Thank you. Thanks so much.
Thank you. Thank you for your time.
Thank you.
We're going to press on straight away with our next guest. Our next guest is sex worker and queer well-being activist, Kayden Gray. What a
Hello, thank
guy.
you. Thank you so much for having me today. This is a pleasure and an honor. Hi, Susan. Hi. Hello, Matthew.
Hello. So,
what's going on?
What's going on? Okay. No, I'm fascinated by this because you made the decision to be openly HIV positive as a sex worker, as a performer and entertainer. Were you nervous about the impact that would have on your career?
I was terrified, and of course, I guess that kind of goes without saying. But I was already part of Impulse group at the time, and it really motivated me, particularly because living with HIV and being part of the industry had been quite isolating and traumatic, and there was rejection that I expected, but it was still very painful. And this is despite a lot of people in the industry actually being really supportive and very well versed in sexual well-being. But it made me feel really powerless to live in that secret. So actually being open and telling everyone that I'm HIV positive was a way for me to claim power. Unfortunately, though, STIs don't sell well in the sex industry, or I mean, that goes again without saying. So I did lose on popularity.
Doesn't sell that well in my industry, but it keeps me busy.
Right, but I suppose that's it.
In sharing information, I hasten to add.
In our industry, it is just something that's not welcome. It's not welcome as part of the conversation, which really hurt me because it is part of my sex life, and sexual health is part of our sex life, right? So I did lose quite a bit of work. I believe I can't really tell you how much. And also the response I got was mainly positive on paper, but people were saying things like, I hope you get well. Are you okay? I'm so sorry. So actually 2017 was one of the hardest years of my life, but it also set me on a path of reevaluating that stigma for myself and for the community, which is why I'm so hot on talking about these issues and incorporating them into my work.
Wonderful. And yeah, Kayden, you use your platforms to share information about PrEP and U equals U. What difference do you think it makes to get the messages across with you being a porn star?
I think it makes a huge difference because, well, first of all, sex sells so well. It's so well spread. I would say risking, obviously. It's a risky statement to say everyone watches porn, but most people watch porn. And so it's such a massive platform. And I think utilizing that is just something that hasn't been done much. But to hear it from someone who is kind of someone you look to for entertainment, for sex, makes a huge difference, because sex work gets to celebrate sex, which historically isn't something that most activism has done, unfortunately. And obviously there are more and more exceptions. These days we become more and more sex positive. The sex work literally is, like, we don't have to be PG about it. So we occupy the same space as sex occupies when people have it. And activism often is quite PG and sexless, really. So it doesn't even kind of, it doesn't activate the same parts of the brain as when you have sex, or, you know, when you watch porn. So I think it's a huge untapped market for educating people.
I used to work at an organization called Gay Men Fighting AIDS, and we used to put out the most explicit materials to support our work. And I had to tell my parents, please never Google me, because you're going to find a lot of material which
I'm a porn star, essentially. And that would be one of those exceptions. And I suppose Impulse Group would also be another of those groups that really did tap into that really trying to tap into that and make it, you know, make it sexy.
But
so I really appreciate that.
You got to be, it's got to be about sex, because it's about sex. And I think the other thing is that there was a lot of really early campaigns where they talked about sex like it was a kind of function kind of thing. It's just like, you've got to talk about pleasure. You've always got to talk about pleasure, because if you don't talk about pleasure, you're not actually communicating in the space where we hope people are generally when they're having sex.
Right. It's got to be, I mean, sex is hot. And if you really respect, if you respect that space, really kind of treat it as something really beautiful and sacred, then I think you're into a winner.
No, I mean, actually, the person who first introduced me to, and who's a friend to both of us, and a supporter to both of us, is a man called David Stewart, who we sadly lost earlier this year. And I think you and I, we've spoken about this, and his loss is immense for us as friends of his, and to the communities that he worked with. He was an incredible chemsex activist, an advocate, but I'm spending time thinking about the benefits I got from him. And so, I mean, what lessons has he taught you? What lessons do you utilize from your knowledge of him, from your friendship with him?
Probably too many to tell just in this one conversation, but one of the main things, he introduced me to activism. And I remember it was when I was shitting myself, because I was just about to do a public conversation. I wasn't out, and I told them just before that. And he then became this person who I didn't become friends straight away, but he like, to me, he led by example, because he was like me, queer, and like so many of us queer, and like so many of us a sex worker, like so many of us a drug user, and was positive, has had his very dramatic experiences with sexual well-being and mental health. And so he made all of that normal for me. He allowed me to have peace, and also taught me audacity, the way he handled himself. He was a superstar. He was just a hero to me, and taught me communication, taught me boundaries. That's something that I didn't really know much about before the relationship with him. And I think that's something that we all know. David was very boundaried.
He said to me, "Oh, you're very boundaried, Matthew." So you're very boundaried.
You know, what is it? It takes one to know one, right?
I guess that's it.
But I do think, like you said, it is such a loss to the community. So I do owe him a lot. I think we all owe him a great deal.
I really love the expression, which I believe is Jewish in origin, or instead of saying rest in peace, they say, may his memory be a blessing. And I like that. Kayden, it's been wonderful to talk with you. Thank you so much.
Thank you.
Likewise.
Thank you so much, Kayden. Bye.
And already half an hour.
We're out of time. We've run out of time. I'd like to say a huge thank you to our three absolutely incredible guests. Kevin, Martha, and Kayden. I'd also like to thank Disruptive for all of their technical wizardry having this work today.
And we would like to thank our sponsors, Theratech and Wandsworth Oasis. And remember, this episode and all past episodes are available on YouTube. They're available on NAM's Facebook and Twitter, and they're also available on the aidsmap website. So if you want to go back and see some of the past episodes, you can do that, or you can tell all your friends about this one. It's been wonderful to see you all. We will be back in 2 weeks' time on the 9th of May with a very special edition of aidsmapCHAT, because we will be celebrating NAM's 35th anniversary. Can you believe it? We have been around for 35 years, providing accurate and accessible and reliable information about HIV and AIDS.
That's wonderful. I was just a baby at the time, so I can't remember.
Sure you were, Susan.
But see you all in 2 weeks' time. Thank you so much for joining us.
Thank you.
Thank you. Bye.